Bismillahirrahmanirrahim. Hello and welcome back, friends. Welcome back to another video lecture by microbiologist. Today in this video lecture I'm going to explain vitamin profile test. Means we are going to explain that how many tests are performed in vitamin profiles, or we are going to see the vitamin panel related test. Okay, so we already talked vitamins test, like we talked vitamin A, vitamin B, all the types of vitamin B, vitamin C, vitamin D, vitamin E and vitamin K test. Now this is the last video lecture that is related to the vitamin profile test, and it is the vitamin profile panels or vitamin profile test, etc. So my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. So the main content that we are going to explain in this video, we are going to see that what are vitamins, function of vitamins, diagnostic purpose of vitamins, test procedure, deficiency of vitamins, normal range, main causes of high and low vitamins, and finally we will talk about the treatments. Now let's see that what are vitamins. Remember, vitamins are the essential or non-essential, or we can say micronutrients or organic compounds. Now vitamins are the essential because we obtain it from the food, and vitamins are the micronutrients because we get vitamins in a low amount, but they can perform a large number of function in our body. Moreover, vitamins are organic compounds because vitamins contain carbon atoms. Vitamins are also the non-essential because it is also stored in our body. Some of the vitamin can store in our bodies, I already explained. Okay. Next we have vitamins. That vitamins are actually the test that is performed especially in the biochemistry test. If you guys remember, we already talked different biochemistry test, like we have talked kidney related test, liver function test, kidney function test, okay, and we talked diabetic test. Now this is the vitamin test is also the biochemistry test as well. Next we have that vitamins are essential as well as non-essential vitamins as well. So these are a short introduction related to the vitamins. Now let's see that what are the types of the vitamins. The main types of the vitamins are fat soluble vitamins. In fat soluble vitamins we have vitamin A, which are called as retinol. We have vitamin D, we have vitamin E, which are called as tocopherol. We have vitamin K. Okay, now these are all the fat soluble vitamins. Then we have water soluble vitamins, like we have vitamin C, which is called as ascorbic acid, and vitamin B. So all the types of the vitamin B and vitamin C are the water soluble vitamins. Now these are the types of vitamins. Now let's see the function of the vitamins. So there are different function of the vitamins. Each vitamins have their unique functions. I'm going to explain all the vitamin function here, but if you want to see all the function of the vitamins in a detail, so I will recommend you that go back to my channel and watch all the vitamin related function as well. So in this video I'm just going to explain one by one function, not all. First of all, we have vitamin A. So the main function, the most important function of the vitamin A is to maintain the good eye vision. Next we have vitamin D. It is very important because it can make our bones strong because it absorbs the calcium. Next we have vitamin E. It is helpful in antioxidant activity because it can perform antioxidant activity. Due to this way the cell will be protected from the damages. Then we have vitamin K. So it is important for the blood clotting. Then we have vitamin C. We call that ascorbic acid. It is really important for the immuno function as well as in wound healing. Then we have vitamin B1, which is called as thiamine. It is important to convert the food into energy. Then we have vitamin B2, which is called as riboflavin. It is also important to produce energy as well as it is important in cellular function. Then we have vitamin B3. It is called niacin, and it is important in the metabolism process as well as in energy production. Then we have vitamin B5. We call it pantothenic acid, and it is important to synthesize the hormones. We have vitamin 6. We call it pyridoxine. It is important for the brain development and proper brain function as well. Then we have vitamin B7. We call it biotin. It can be responsible to metabolize fats, proteins and carbohydrates to release the energy. Then we have vitamin B9, we call that folate, so it is really important and necessary in the DNA synthesis as well as cell division. Then we have vitamin B12, we call that cobalamin, and it is important to produce RBC or to make RBC as well as to maintain the proper nerve function. Okay, so these are all about the vitamins function. Then we have the symptoms of the vitamin deficiencies. So if let's suppose the vitamin get low, so what type of the symptoms will be appear? First of all, we have night blindness. Vitamin A, due to the vitamin A there will be night blindness. Due to vitamin D there will be bone pain, bone weakness. Okay, due to vitamin E there will be muscle weakness. Due to vitamin K there will be ASA, bruising means clotting problem as well, or there will the blood will be not clotting, or there will be increased bleeding as well. We have vitamin C deficiency can cause scurvy, which means bleeding from the gums. Vitamin B1, vitamin B5 and vitamin B9 deficiency can cause fatigue. Vitamin B2 deficiency can cause cracked lips. Vitamin B3 deficiency cause pellagra disease, which is the dermatitis, diarrhea, dementia. Vitamin B6 can cause irritability. Vitamin B7 can cause hair loss, and vitamin B12 deficiency can cause numbness in the hand and feet. Now let's see the diagnostic purpose. So mostly the vitamin profile tests are specially responsible to just check the level of the vitamins in the blood. Either it get low or high. If it get low, there will be the problem. If it get high, there will be the problem. I will explain it into the next slide, into the upcoming slide. Then this test is also important to just check the nutritional status or the nutritional level. This test is also important to check the supplement efficacy, the supplement which are providing to fulfill the vitamin need in the body. Then we have the normal range of the vitamins. So first of all, we have vitamin A. Their normal range in the body is 20 to 80 microgram per deciliter. Vitamin D normal range is 20 to 40 nanogram per milliliter. Then we have vitamin E. Their normal range is 5.5 to 17 milligram per liter. Vitamin K 0.1 to 2.2 nanogram per milliliter. Then vitamin C, their normal range 0.6 to 2 milligram per deciliter. Then we have vitamin B1, their normal range is 70 to 180 nanogram per ml. Then we have vitamin B2, their normal range is 8 to 30 microgram per liter. Vitamin B3 0.5 9.1 microgram per milliliter. Vitamin B5 1.0 7.0 microgram per milliliter. Vitamin B6 5 to 50 nanogram per milliliter. Vitamin B7 100 to 200 nanogram per liter. Vitamin B9 3 to 17 nanogram per milliliter. Vitamin B12 200 to 900 picogram per milliliter. Now these are the normal range. Then we have the diet rich in vitamins. So we already talked that which food contain high amount of the vitamins. So let me explain again. So if we talk the overall, so we have fruits. So all the fruits items, like we have grapes, banana, apple, mango, oranges. So all the fruits contain what? Vitamins. All types of the vitamins. Vegetables, especially green vegetables, okay, they contain what? They contain the vitamins. And there are tomato, vegetable like potato, it also contain vitamins. Then we have poultry products like egg, cheese, butter, milk, meat, chicken. So these items are also contain vitamins. Then we have fishes like salmon fishes. Then we have whole grains like oat, rice, barley, etc. So these items also contain vitamins. Then we have nut seeds like sunflower seeds, like we have almond, walnut. So these are also contain vitamins. Now let's see the procedure of all the vitamins test. So whenever you perform any type of the vitamin test, you need to take the blood in gel tube, heparin tube, red top. Okay, then what will you do? Before that, you must guide the patient that the patient should be on a fasting 12 hours. Then you will collect the blood. Okay, next, once you collect the blood, so then you will centrifuge the blood to get serum or plasma. Then what will you do? You will perform the test on a fully automated machine or semi-automated machine. Fully automated machine, like we have Architect, we have Mendre, we have Meglomi. And semi-automated machine, like we have FineCare, we have Digrade, Lofia, etc. Then we have the main causes of the low vitamins. So vitamins level get low due to the diabetes and anemia. It is due to liver kidney disease. It is due to medications like antacids, antibiotics, diuretic medicine. It is due to alcoholism, smoking, lactation, pregnancy, newborn babies, aging, poor diet, malnutrition and malabsorption disease like we have celiac, Crohn's, ulcerative colitis, irritable bowel syndrome. Okay, so these are the disease through which the vitamin level get low. Then we have vitamin the level that get high. It is due to the high supplements of the vitamins and fortified foods. Now let's see that when the vitamins level get low and high, what type of the treatment should be provided. If let's suppose vitamin level get low, so then we will provide the vitamin supplements. If it get high, so then we have to prevent the patient from or we have to guide the patient to stop the vitamin supplements. We have vitamin rich food which are necessary when the vitamin level get low, and it should be avoided when the vitamin level get high in the body. Then we have all the medical conditions, like we already talked that there are different types of the diseases caused by the high and low vitamins. So if there is a diseases, and if we control all the diseases, so we can also control or maintain the level of all the vitamins. So this is all about the vitamins profiles. Thank you so much for watching this video. If you like this video, make sure to hit the like button, share this video and subscribe the channel. If still you have any kind of question, you can write your question into comment. I will try my best to give you answer as soon as possible. Thank you so much for watching.